welcome back to the video series Awareness Campaign from the Maryland Healthcare Coalition Against Domestic Violence, centered on the intersection of health and intimate partner violence. I'm Lauren Doherty, the Training and Outreach Specialist with the Healthcare Coalition and the host for the video series. Today I'm with Colleen Moore, Program Manager of LifeBridge Health Center for Hope, Violence Response Team of Grace Medical Center, and Steering Committee member of the Healthcare Coalition. Colleen today is going to be talking with us about how to create a safe environment for the patient to disclose intimate partner violence. Colleen, maybe you can get us started by talking a little bit about why it's important to create a good environment for disclosure.
Sure, Lauren. It's important to keep in mind the reasons why someone might not want to disclose, what they're afraid of, what the barriers would be. So perhaps they've been told by their partner that they don't deserve help or they're at fault and that nobody would believe them. Maybe it's due to years of racism or other oppressions where they've developed a mistrust of the healthcare system itself, and they're afraid of what would happen if they made that disclosure. Sometimes people are afraid that if they tell someone what's happening, there'll be a police report or somebody's calling CPS, and for that reason they don't make the disclosure. It may be that that what they are experiencing, they don't interpret as abuse, so they don't know that what's going on is wrong and that there's help available for them.
So keeping this in mind, how do you go about creating an environment that helps a patient feel safe to disclose?
Sure. First and foremost, before engaging in any discussion about intimate partner violence, the patient should be provided with privacy and confidentiality. You wouldn't want to ask any questions with anybody else in the room, even if it's a child or another family member, because you don't know what the lines of communication are in that family, and you wouldn't want somebody to accidentally make a disclosure. This is really important to think about when we have non-English speakers. If you're using a translator, make sure you're not using a family member in particular when you're talking about intimate partner violence.
And what if you find that the patient's partner is hovering, or maybe you can't get the patient alone during the visit?
Well, best practice is really to have a standard protocol where every patient has the opportunity to talk in private to their healthcare provider. So that way it's not like I have a suspicion about you, I need your partner to leave. It's more that that's just the routine. But there's always cases where you encounter the need to separate people, and you should probably strategize with your coworkers beforehand. Maybe you're going to follow this patient down to X-ray and have that conversation there. Maybe you can suggest that somebody go take a urine sample and you follow them off to the bathroom. Or maybe you have the partner go to complete some paperwork somewhere else. But it's really important to remember that if you don't have the opportunity to ask in private, that you just don't ask the question at all, because it could be worse for the patient if the partner understands that people are asking about this issue.
And what are some other strategies to create an environment for disclosure?
Sure, there's other things that you can do in the environment to make it more comfortable for people and to raise awareness where they know that this is an okay place to talk about these issues. Having posters around, having brochures available, maybe in a bathroom, in the exam rooms, out in the waiting area, those are all good measures to let people know that it's okay to talk about this issue with your healthcare provider. And many of those materials are available on the Coalition's website. As well, it's really important that we define our role and the limits of confidentiality and mandated reporting requirements to the patients we talk to. So that way patients can make a better informed decision for themselves about what they want to disclose. And finally, it's really important to be engaged with patients and make sure you're making that connection in terms of your tone, your body language, your words, so that you're making eye contact and that you really seem like you're open and interested to what they're ready to share with you. And even if a patient is reluctant to disclose and you kind of sense that, you want to leave that door open so that they know it's an okay place for them to come back. And you can even do some universal education. So you could say something like, you know, if this isn't happening to you, maybe you need some of this information for a family member or a friend, or just to leave the door open. If this ever does happen to you, know that you can come back and find help here.
Well, thanks again for being here today, Colleen, and sharing such important information with us. For those of you who are interested in learning more about how to create that proactive and effective response to intimate partner violence, or you would just like to connect with us, please visit our website at www.healthanddv.org.